Hi everyone, welcome to week 5. This week we will be jumping into some topics related to assessment in clinical psychology. So starting with chapter 7, we'll talk about diagnosis and classification issues. And then in chapter 8, we will discuss some clinical interviewing skills. A good place to start when we talk about diagnosis is how we should define quote unquote abnormality. And by abnormality, what I mean is, how do we decide what is considered a mental health disorder versus a typical part of the human experience? So on one hand, we could look at statistical infrequency. So we could say that people who are kind of outliers in terms of their behavior or personality, that would indicate a disorder. But this isn't always reliable because not all rare traits are maladaptive, and maladaptive traits can be very common. So these examples are just showing that, having a rare skill is not necessarily a disorder. It could be a gift. And something like being afraid of the dark could be seen as maladaptive, but it's very common. Another way we could look at it is how far it deviates from social norms. This again has some flaws though. On one hand, social norms are constantly changing, so it's hard to keep up with. And what's considered socially normal or abnormal might not be associated with whether it's adaptive or maladaptive. So, having a unique style doesn't necessarily mean that somebody is having dysfunction. And things like technology, this is a social norm now, and it's hard to say whether that's adaptive or maladaptive. So some of the factors that people commonly cite as helping us decide what is a mental health disorder, what is considered normal human experience, is a combination of factors. So it may include things like statistical infrequency, deviance from cultural norms, but we also need to look at the personal distress to the individual, as well as their functioning. And in particular, a lot of times people look at their social functioning. A helpful theory for thinking about disorder is called the harmful dysfunction theory. It sounds pretty basic, but I want to break it down because there's two really important parts that are important to make sure that you know both of them. And so in the harmful dysfunction theory, it's stated that harm is a value term based on social norms. So what is harmful to a person depends on how their social group sees it. Whereas dysfunction is, as they define it, a failure of a mental mechanism to perform a natural function for which it was designed by evolution. And this is much more about, is the behavior getting in the way of a person's kind of natural function to survive? So harmful is likely going to vary based on the culture or subculture of the group, whereas dysfunction is more about an individual's ability to function in their environment. And so you can see this combines cultural values with scientific components, and that's why both parts of this definition are needed. So I'm going to pose a discussion question, so feel free and comment what you think. So in this example, we have Michael. He is a 29-year-old man who spends most of his free time alone in his bedroom. Although he performs well at work, he has few friends or hobbies. Instead, he enjoys reading comic books, playing video games, and constructing elaborate Lego sets. He lives with his parents in their basement, has a positive, if uninvolved, relationship with both of them. One of Michael's acquaintances recently encouraged him to see a therapist so that he could work on becoming more social and outgoing, but Michael has expressed little interest in following through on this idea. Michael's parents also frequently worry that he is depressed because he spends so much time alone. However, Michael tells them he is perfectly content with his life and that he would not want to change anything, even if he had the opportunity. So for a case like this, I'm curious to hear everybody's thoughts. Do you think Michael's level of impairment is at the level necessitating a label for a mental disorder? Or do you think this is just kind of within the normal range of human experience and it's up to Michael to decide whether or not he wants treatment? So go ahead and comment your thoughts and think about how it might relate to that harmful dysfunction theory. So in the DSM defines mental disorder as a clinically significant disturbance in cognition, emotion regulation, and behavior. And so this is indicating that dysfunction part of the harmful dysfunction theory. And it's a dysfunction specifically in mental functioning. And according to the DSM, expectable reactions to common stressors are not mental disorders. So feeling anxious right before you have a big exam would not be considered a mental disorder, but feeling anxious on a day-to-day basis that's not tied to something specific would be. However, I put this asterisk here because there's kind of a caveat. There is a diagnosis called adjustment disorder that is actually often used to diagnose people who are kind of adjusting to a stressful life event. And adjustment disorder, I think, is kind of unique because it's often used as kind of a placeholder when like health insurance companies need a diagnosis on file in order to provide psychotherapy services. So in a way, I think adjustment disorder is sort of an exception to this rule. But overall, the DSM is written to not include expectable reactions to stressors. It's supposed to only include, these clinically significant disturbances. So a little bit more about the DSM. The DSM is published by the American Psychiatric Association. I want to note this is a different APA. This is not the American Psychological Association. And that's important when we talk about how the DSM is created. So the DSM reflects a medical model of psychopathology. So we have each disorder, they're organized into categories, and then they have specific symptom kind of checklists associated with each, much like how medical diagnoses would be framed. And something we discussed back in chapter 4 is how the culture and values of people who define the disorders play an influential role in the definitions that are produced. So a lot of the disorders in the DSM were created by psychiatrists who are, oftentimes white men in Western countries, and this is going to change kind of which diagnoses are included in the DSM. So why is it important to define what psychopathology or mental health disorders are? There's a number of reasons why it's important. So for one, just having a diagnostic label strongly impacts the amount of attention it receives from clinical psychologists and the public. So if a diagnosis doesn't exist, then people aren't going to be talking about it. They're not going to be developing treatments for it. And so this is a big reason why it's helpful to have these diagnostic labels and categories. It provides a framework for researching the phenomena in a more standardized way. So think about if we did not have a clear definition for what generalized anxiety disorder is. It would be hard to categorize anxiety in order to study treatments for it, because we all have moments of anxiety, and some people have, panic attack symptoms. Some people have specific phobias of things, and then other people have this kind of generalized anxiety that's more characterized by worrying. And in order for us to kind of break these into different groups so that we can study and understand them better, it's helpful to, have this collection of symptoms so that we have a standardized way of looking at a disorder. And then third, it affects which characteristics are considered disordered in the first place, which is going to affect every step of clinical work. So formulation, assessment, and treatment. And then why would clients care how psychopathology is defined? So for one, having a diagnosis can help people identify their own experiences as being understandably difficult. It provides some validation that what they are experiencing is a known phenomena, that it's something that can be treated. And so this can help them also communicate their problems to others and provide a sense that they're not alone, that others are dealing with the same difficulties. Also importantly, it can help gain access to treatment. So as we learned in a previous chapter, most people are accessing mental health services through managed care systems. And oftentimes managed care systems require a mental health diagnosis to authorize treatment. So being able to meet criteria for a DSM diagnosis is often one of the barriers to accessing psychotherapy through your insurance company. But diagnoses can also have negative ramifications. So it can lead to stereotyping of individuals, especially for certain diagnoses such as schizophrenia. There's a lot of fear and misinformation around diagnoses like that, and it can lead to a lot of stigma and stereotyping. Diagnoses can also have an effect on the outcome of legal issues, for example, custody cases. So if one parent has received a diagnosis that's considered severe, that can impact how some of these decisions are made. And going back to chapter 3, there is a phenomena and potential consequence of overdiagnosis and overly expanding the DSM to include things that were once considered within normal human behavior.